Hello everyone and welcome back to a brand new episode of MedMics. I am Pranav and today we have with us a very special guest, Dr. H.P. Shashidhar sir, Professor, Department of Pathology, whose dedication and enthusiasm extend far beyond the classroom. A true pillar of our institution, sir has played an integral role in various cultural, academic and administrative endeavors, inspiring students and colleagues alike with his infectious energy and unwavering sense of commitment. We wholeheartedly welcome you to today's podcast.
Thank you one and all for having me in this podcast. I feel really privileged to be a part of this podcast and more privileged to be a part of MMC. Thank you very much. Thank you.
Sir, as both an alumnus and now professor, you have spent decades here at MMC, living through so many changes in both medicine and teaching. I'd like to begin with a cliche question. If I ask you to describe Mysore Medical College in a sentence or in a couple of sentences, what would you say?
Yeah, it's really a tough question. To put it in one sentence, it's a tough thing, but still I'll just try to put that. So we got some places as cradle of civilization. We take name of Harappa, Mohenjo-daro. Those are all cradle of civilization. I'd rather put Mysore Medical College into that category of cradle of the medical civilization. Rather, where so many people have graduated from this and they have spread out all over the world and they are into this healing business and the most noblest of all business in the entire world, healing the disease and most importantly, finding comfort in their profession. I think I'd rather put it as in that way. It's a cradle of medical civilization, Mysore Medical College.
Oh, so very interesting way to look at it. Sir, so like you said, Mysore Medical College has a very long history and a very rich heritage. What do you think makes this college different from the other medical colleges of India?
Yeah, so just to put it in a few words, if you just step into this as a student or students of Mysore Medical College, we might have felt that. If you just step into the campus of Mysore Medical College, you feel a connect to this, isn't it? So it's just like as though before coming here, you'll not have anything. Once you get into that, you feel like, yeah, I belong to this place. Rather, this place is calling me. So that connect is more important, and I think I'm finding that connect, that dedication in each and every student whoever comes to Mysore Medical College for their medical profession, for their learning, and I also find the same connect with the teachers as well. So particularly if you talk about after the graduation, we got this alumni association, the involvement of all these alumni. If you see that, you can see that how much belongingness they show to this medical college. I have not seen anywhere in the world where they can find that belongingness to their mother institution. We fondly call it as MA, Mysore Medical College Alumni Association. It's MA. So it's nothing but it's a mother to you, mother of knowledge, it's mother of your existence. And that is what makes me so interesting to be a part of Mysore Medical College. It's really great to be here. Yes.
Right. So as you described, sir, you were once a student of Mysore Medical College as well, where you completed your post-graduation. So could you take us through a typical day in your PG days back then, from morning to night, maybe?
Yeah. I remember my PG days. Of course, we had, nowadays, if you see the professors, we see professors like me, so easygoing, and some people don't look like professors also. Some people don't take us also as a professors. Oh, he is a professor. Okay, once you tell, then they'll come to their professors. So that's been the thing, because the life has changed from that part. It has evolved. At that time, when I came in the year 2000, so we had those stalwarts, we had those professors. I still remember Professor Karyappa. So you should imagine, you just imagine 6 foot man with that presence, with that subject in his thing. So any time you talk to him, you'll always feel like, of course, we need more and more about it. So we had Professor Karyappa, we had even Dr. MC Raghupati, a wonderful teacher. So we had those people during our days, like you don't feel like they are guiding you, but just being with them will feel like, so of course we are at the right path. So that was the time when I really treasured my days as a postgraduate. I think I can, sometimes I feel really jealous about the UG alumnus, because why I couldn't become a UG alumnus here? Because once I came over here, I see you people, I see many of this, the amount of enjoyment, the amount of knowledge you acquire. So definitely this is the place for both UG, PG, and I can add also to that, this is the place to be a teacher as well. So that's a fantastic thing for me. Yes.
Wonderful, sir. Yeah. Sir, also, sir, going back in your days, any specific, sir, fond hostel memories or campus memories that you have, which only a person who's graduated from or who's been a student of Mysore Medical College will understand? Any funny memories, an inside secret?
Yeah, it's not like funny. It's a long process. Like now, I think in 2001 or 2, earlier we used to have these NSS health camps.
Right.
So we used to go along with the students. We used to pick those 25 boys, 25 girls. We used to go with them, and we used to reside in a rural place, in a village, and we used to spend 10 days there. So we used to spend 10 days, and also we used to interact with the people. So daily we had that routine. We had one such camp of NSS in Siddhamanahundi. That's a famous place, of course, by our Honorable CM belongs to that place. So we stayed there for 10 days. I still remember each moment of the time which we spent along with the students. And that's about, I think, 2000 batch inmates. We just had their 25 years of their thing. They had celebrated recently, and I really they came, and I could see each one of their faces. They forgot, all of them. They have become neurosurgeons, they have become gastrosurgeons, they have become directors of famous institutes. But still, the one thing they wanted to remember, those 10 days. Even I also feel like those 10 days were really cherishable. And of course, recently we had this Centenary celebration as well. And each year we'll be having Ma Utsav. So where all the alumnus from all over place, they'll pour into MMC, and we'll be having all those exchange of these old memories. And those days, particularly those 2 days during that 1 year, each year, and those camps involved in that. And also we had one anecdotal thing which I want to tell is, when we entered here as teachers, we had the training of teachers. So we'll have that 3 or 4 days program, training of teachers, where our senior teachers will be teaching us what to be a teacher. So they'll get us all the intricacies. So they'll give us questionnaires, pre-test, post-test. Most importantly, like thing is, it sent us back to our UG days. So where I think even at that time, even the maturity level was also not that much. 2000, 2001, we were still 26, 27. Everybody was still in that age, and we really had wonderful time. And even if you believe it or not, the teachers used to teach us, and we used to do the same thing which you people do with the present thing. So making galatas behind this thing, and switching off the lights, sleeping in the class. So it was just an experiment. So it not only taught us what to be a teacher, it also taught us how difficult it to be a teacher. So how to control the students. So where we ourselves were students, and we were, as once in a while, we ourselves went out of control. So we really cherished those days where we had the TOTs. Right. So with all our colleagues, everybody were there. And also we used to have get-togethers. So get-togethers each month or every 2 months we used to have get-togethers, and all the colleagues. Right. So now everybody has become busy. So very hectic. Right. So a lifestyle. At that time, it was not that. Mysore was a wonderful place. It's still a wonderful place. And MMC, to that, it was a crown for us. So if you just tell us, even after finishing 4 o'clock, hardly we used to leave campus. Till 6:30 we used to spend time all with our colleagues. We used to exchange ideas. Right. And we used to have one teacher association room where we would play carom and TT. Table tennis and all those things. Those things, I think, those memories are there forever for us. So even my colleagues will also agree with that same thing, where we had so much frequent get-togethers. And I think the more we meet, what I feel, the more we meet and the more we interact, the less the ego that develops between us. Right. So there's no chance of any misunderstanding at all. So everything was so smooth. So as and when, I think the transition occurred by 2015 or 18, I think. After that, there was some amount of disconnect. Maybe everybody got busy, and we were not that busy. Maybe we can be subjective as well at this situation. But I think those days I really cherish those, and also I cherish those days where the students will be meeting us. So 2000 batch, 2001 batch. So most of them, they're all settled abroad. Many of them are settled abroad. Few of them, they're in Indian Institute of Science. Few of them are working in the premier institutes of medical college. Once they come, you should see the amount of the belongingness they always show to us. So nowadays, I'm not, only few I can see. I'm not complaining as such. But if you see, in the corridor itself, if they come, they start with bowing their heads, touching our feet. So that used to be the commitment, that used to be the devotion of those students. Even if they come now also, recently 2023 or 22, one batch had come, even I felt the same thing. So nobody were that casual, everybody had that devotion in their mind.
So that's really wonderful to hear.
Yeah.
So also, not just being a teacher, you are a wearer of many hats, to be honest. You've taken up so many roles and responsibilities. Sir. Could you care to elaborate on that, sir, on your various experiences apart from teacher?
Yeah. First thing is, it's not apart from teacher, it's as a part of teacher.
As a part of teacher.
Yes. Right. So I really cherish being a teacher, and I'm really not bothered whether I started as a lecturer. I started as an assistant professor, and then I became an associate, and then I am now the professor. But still, I really don't mind what's there in front of my, see what designation is there. Of course, that will be there for academic purpose, that will be there for administrative purpose. But as a teacher, I am teaching in MMC. That's the most coveted thing which I can ever say. So that is one thing. And you're talking about the memories.
Right, sir. Also, like you were the cultural chairperson.
Oh yeah. The other roles which I used to take. Yeah, earlier, like I told you, Mysore is such a place where it's rich culturally. It is rich literature-wise. You take the art-wise. You take everything. You take. This is the number one place which I can suggest for anybody. Right. Not in India, in the entire world, I can say, because such is the heritage of this one. So I was there as a cultural chairperson. Earlier, of course, many a times, like it's not like it's your choice. You'll be pushed into it, and once you are pushed into it, you'll start enjoying that. Is it not? So those things will happen sometimes. So need not be by your choice. By chance you get it, but once you start enjoying, then you'll feel like, I belong to this one. So I was into this cultural as cultural chairperson. I still remember my teacher, Dr. Hemlata Madam. Okay, so pranams to her at this juncture. So she was the one. She was the chairperson. I was the co-chairperson. For many long times we were there, and she herself was a very good musician as well. She was a very good singer as well at that time. Still she is. And after she got retired, I took over the mantle of this one. We really had wonderful times as a cultural chairperson. And it's a deviation. See, if you are getting into this medical field, if you are particularly, I'm a pathologist, so I'll be into seeing. I'll always be inside the microscope. I'll be with the postgraduates. I'll be dealing with the specimen. I'll be dealing with these cancers, whether there's lymphomas or anything like that. But it's a deviation. Everybody should have this deviation, what I feel. So it not only makes you, it rejuvenates you. So like the original, what you're there in the medical thing, so it always gives you extra energy if you are little have deviation from these things. Cultural committee gave me that deviation. So I still remember those boys, those students getting me on the stage, making me dance along with them. Of course, I used to sing that song. I still, many of them remember me with that song, Santoshake. So nobody remembers me what I taught in, it's just like saying. So nobody remembers me what I taught them in pathology, but they always remember me, you are the Santoshake teacher. Okay, so that song I used to always sing. That's a favorite of mine as well. So, but I really cherish those cultural, and I've seen this transition happening. At that time, it was all conventional. Nowadays, all these gadgets, all these thing with the extra mics, extra all these technologies involving the Samskruti and all that has come. At that time, it was plain 1-2 speakers. two mics were there, and everything used to happen with that one. And that was so simple, and yet it was having such a grandiosity in that stage.
Right.
But I'm not blaming at this stage. Of course, you should be going along with the technology, but we used to really enjoy that those days. So there was a one-to-one communication,
Right.
so which I feel which is missing nowadays. Maybe the generation gap has taken over. At that time, we were just around half a generation more than what the present students were there. Now I'm almost 3 to 4 generations away from you people. So maybe that's the thing which has come to my mind. But still, I feel like we should not forget our roots. We should always go back. We should always cherish those old dreams, old memories, so which we had. That was a wonderful time. This thing, yes, yeah.
So also one of the greatest milestones which you've just completed, our centenary year. Sir, and when we had a part of the centenary celebration, I think it was a great opportunity to relive the old memories with almost alumni coming in from all over the world.
Exactly.
And you also played a very important role in that, sir. So what were your experiences?
Yeah, it's rather than calling as important, I would like to feel I was privileged to be a part of this centenary, because none of, see, there are so many people who have graduated from this for 99 years. But I am here at this juncture on the 100th year. So same in your case as well. You people were
lucky enough.
Lucky enough to be a spectator of that centenary year. We had a wonderful centenary year, 1924 to 2024. Just imagine the travel MMC has done.
The path, right.
Is it not? The path which has traveled, and we were all part of that one. We had these committees, so many committees, and we had these wonderful. I think it was a learning experience also for us. It was a learning experience where thing is, it's not like you have done one centenary and you will be doing another centenary. The centenary comes once in a lifetime, is it not? So whatever you are doing, it's doing for a new thing. And we had so many seniors for us to guide us. And they were a part of that one. I can remember many of these stalwarts, alumni. First and foremost, I can remember Dr. Chandrasekhar Shetty, sir. So you should meet them once in 6 months, at least to rejuvenate your energy, what I feel. So such is the energy with the person, the Shetty sir exudes. And he was one of the organizing secretary of that one. Of course, at this juncture, I remember Madam Kanta Madam. So she is the mother of all alumnus. Everybody thinks her to be the most prominent stalwart amongst the alumnus. Also, we had Dr. Sriram sir from Malligaya Center, Bangalore. Dr. Paramesh, he is an associate with the Indian Institute of Science. And we had our director and dean, Madam. She was also an organizing secretary. And of course, we had our president of MA, Dr. Dinesh. Okay, so he did a wonderful, commendable job he did. And we had our honorary president as Dr. C.D. Srinivasmurthy, sir. He was there. He is the one who got this boardroom done, is it not? So such is the belongingness which they feel. And also I remember many of these people who inspired us at that time, Dr. C.G. Narasimhan, CGN sir, which we normally popularly call. So such is the belongingness, if I am not repeating those words, because they are always there. Whatever you talk about MMC, they are the first to come at that. So such is the thing. I was talking about Shetty sir, and he was there always with us, guiding us. And of course, we can't forget Dr. M.A. Shekhar sir. He was one of the organizing secretary as well. So all those experiences they had, they were all, Shetty sir was a VC for almost four universities, if I remember. And Shekhar sir was a VC of Chanchingiry University as well. So all these people, they left their job, the busy schedule, they were with us for all those days. I think we had almost around 28 or 29 public programs we had for 1.5 years. And we had all the alumnus coming from all over world. So particularly, I'm very proud to say that we have one of the best overseas alumnus in the entire India. So ours, at one juncture, if I can remember, ours MMC was the first, stands first in the medical graduates who have migrated to America. So Ghana, they got these graduates of North America. So we were the number one compared to in India, entire India. I don't know what's the status now. And I think we will be cherishing this We may not live for 100 more years. At least till the last breath, we will be cherishing. Right. Who knows what will be there for the 200th year, but the 100th year, a memorable one. Yes.
Yes. Truly, actually, when we joined the students, sir, I think we were taken by surprise by the the unity among the alumni, especially when we come in. The first thing we see our orientation program as well was in this lecture, and it was built by alumnus. So it was really a unique thing that we had seen when we just joined. That, okay, wow, so much alumnus have done for their mother.
Exactly. We are the one who are we'll be welcoming the students. We'll be doing the freshers day, right, and we'll be doing the graduation day. So first and last day we'll be there standing as the guard for them. So, and also alumnus, if you talk, like many of them, they have got so many of them, they have donated generously, and we have got them in FD. And we are very, it's not like, it's our duty. We don't call it as we do it. It's our duty to help our fellow students, economically weaker students, whatever it may be. But many alumnus, they come forward, they put certain lakhs in our account. They want that interest to be paid for them, for the students, needy students, and they are paying, many of them. Now they are paying for their fees, they are paying for their mess bill, they are paying for their books, all of those things. I don't think you can't remember any of the other alumni association which is as active, as caring as MA. Yes.
Sir, one of your fields of interest which had piqued my curiosity was diagnostic medicine, especially that in pathology. So if you look at diagnostic medicine, what do you think is the one thing that students should learn even from the olden methods, even in today's age of machines? What's one ancient method that's, I mean, not ancient, but at least olden method that the students should still follow or should know in this era?
Yeah. Diagnostic medicine, particularly, it has evolved over time. So particularly the treatment aspect and all that, if you think, like, it's all like the same thing is going on in a little bit smaller velocity. But I think diagnostic medicine, it's the highest, what I thought. And most importantly, when we started in 2000, we just had that, we didn't had all these instruments. These cell counters with 3-part cell counter, it came at around 2001 or 2, 3, I think, to our department, and we were very much excited with that. Now we got 7-part, we got 8-part, 10-part. So, but still, what I feel we are missing is that the one which we used to see it under our own eye. So under the microscope, we used to do it manually. All these indices, everything used to do it manually. And now, if you just a comparison, if now even you can do 100 complete mammograms in one day. Okay, so we'll be doing it. At that time, we used to give appointments. So 5 to 6 or 8 per day. That used to be the maximum. So entire day we used to keep those things. So thing is, those are the things which made our basics strong. So nowadays, with the instruments and all that, people have forgotten the basics. So we never know that the MCV will come, MCHC will come. We always see for the normal thing, and then we tell, oh, it is normal, increase or decrease. But we never know what has happened to the cell. There we used to get involved with the sample. So starting from the sample, starting from the anticoagulant, we used to work out with that. Ultimately, we used to land up with the peripheral smear examination. So that was the process, step-by-step process.
So from scratch?
From scratch is to start. And I just told you, around 8 to 9 complete mammograms, that is the one we used to do at that time. Now we are doing 100. So just imagine what's the advancement. At the same time, that personal feel has gone. So that roots we have forgotten. So maybe I think all the students, apart from this automated instruments, we should always go back to our basics, where we should be doing how to calculate those things. So because if at all anything goes wrong with the instrument, one who was very well versed with those basics, we can easily pick up what has gone wrong with this instrument. But one who has grown along with the instruments, we'll never know. We always call upon the engineers. We ask them to do it correctly. We ask them to do validate that. We used to run a standard, add the calibrator in that. So those things, it has become more mechanical rather, what I feel. So, but the basics we are forgetting. So I think all students should get into those basics. So if you are going for any picnic or any excursion, it's a travel which is more important rather than reaching the destination. So same thing, we are missing out that travel and we are just worried about the destination. That's what I think we are missing out with the present medical field. So I'm not that great to comment upon the plus and minuses of medical field. But this is my point of view.
Okay, sir.
We should be more oriented towards the basics,
Right,
back to the roots, what we tell.
So, right, sir. So, also with the advent of AI and so many technologies, what do you think will be the biggest shift in the upcoming years? Obviously, we'll see a very drastic change. We're already seeing in diagnostic medicine, especially with genomic studies, with AI. What do you think would be the biggest shift, sir, in the upcoming?
AI is, first of all, I tell artificial intelligence is artificial. It can never replace the natural one, right? So, but the pluses of that being, so we'll be minimizing many of those errors, the subjective errors and all those things. If I see a cell in microscope, if I say there is pleomorphism in that, so my other fellow colleague, I'll tell it is a mild. It's not moderate or severe. It's a mild pleomorphism. No, it's just within the reach about the basement membrane. So other may feel no, it has become moderate, severe. So that subjectivity may be taken off with this advent of AI. What I feel is with the AI, two fields are the one major which will really get revolutionized. I would rather put it as revolutionized rather than cutting the manpower.
Right.
So first is the radiology and next is the pathology. So that is one thing which I think we should be making use of this artificial intelligence. So more importantly, putting that artificial intelligence also to a right track, we need that natural intelligence as well. Is it not?
Right,
so it can take us anywhere. So because earlier, I still remember seeing all those, if you remember those Terminator series and all that. So is it not? So all those AI based everything at that time they had predicted. We all saw it as fantasies. Now it is becoming it's a fictional one, right? So but now it is becoming a reality, and they also showed us what can go wrong.
Right?
Is it not? So those things I think we need to be more cautious about this artificial intelligence. But of course it is of great help. See, changes should happen. So in Kannada they say parivartane jagada niyama. Is it not? So unless there is a change. So even if water is stagnant for a few days, it will get worn off. Right. Okay, it will get polluted. Right. It should always be flowing. Similar is our knowledge. Similar is our time. So we should go along with the time. We should not resist. That's what for the youngsters I'll always tell. So go along with the time. Evolve yourself, but don't forget the roots. Right. So that's the one thing which I want to tell about. Yes.
So adapt with the AI, adapt with technology.
Yeah, definitely we should do it. Right. So it's what all we are doing it for the betterment of the patients, for the mankind. So there's nothing ego involved in that. It will take away my job, take away his job. Ultimately, it's the patient orientation. So patient should always get benefited in this. So in whatever sense it is happening, we should accept it gladly. That is my feel. Yes.
But still retain that authentic knowledge, that basics. We should still be thorough in that sense.
Definitely. Because nowadays, I don't know whether you people still read textbooks or not. But what I feel is, I wanted to think beyond textbooks. But nowadays, just recently we had interaction. We always tell students, no, first involve with the textbooks, then go beyond textbooks. Is it not? So of course, if you read whatever big thing in a virtual mode. So what I feel is like you can't get that feel. If you read Robbins in a book, so they're taking out that Robbins in a book, which he used to do. So same thing, feeling the pages and holding that along the hand, feeling that the taste of that this thing, that odor and all that. That used to be a different thing. So rather than reading it in an iPad and just going through that one, it makes a lot of difference. I think we should. That's one thing. Again, going back to roots, going back to books. Yes.
Right. So if taking a step back from academics, another one of the highlights in MMC's history was when Dr. APJ Abdul Kalam sir visited us back in 2015.
Wonderful.
And sir, you were, I think, a part of the celebration, and you had the honor of meeting him in person, sir. What struck you the most about him as an individual when you interacted with him?
It's not the honor, it's a privilege. It's a lifetime privilege. Just like I remember my Centenary celebration, I remember those days. Because at that time we had called in for graduation day, 2015 I think. So where all the students also, they made a lot of effort in getting him, alumni association as well as students. We all put conjoined together and we had it, and we could feel that change. Once he stepped into our campus, he was there for around 2.5-3 hours, and you should see his change. Rather than seeing what is there in his, he made the entire area, he changed the entire scenario. So just by his presence, the vibe which you could feel. He got down from the vehicle and you could feel that students who were ready for the graduation, you could feel that energy, the bubbling, they were just wooing like. So that was they were totally uncontrollable. Because seeing him itself, it's a great honor. See, and interacting with him, it's like once in a lifetime. As I remember one thing, so we made him plant a sapling here. Yeah, we can just see that in front of our thing. We have put a placard over that one also. So at that time we asked him to plant that, and we had assigned it to one of our colleague to bring a sapling. Okay, so we were so involved with this arrival that we never knew what can happen next. So we brought that sapling. Dr. Dinesh, we were all sitting there. We asked him to plant this one. Such is the the questioning ability of that person, knowing that he just wanted to know more and more, even at that age. Okay, so of course, to know the knowledge, there's no age bar. And seeing him, that's the first instance which I could feel. He asked us, "What is this sapling?" And we just kept blank. We just didn't know what is a sapling. No, he just then the next question is, "Why you are making me to plant this sapling?" He just wanted to know the reason. So maybe he wanted to learn, like maybe this sapling is something different, something special, and by making this happen to me, maybe I may. He wanted to know something, but we were so blank. Of course, I think APJ sir got it that we never knew, we don't know about it, and he just skipped that one. And during even the interaction, so we took him to the stage, and he just wanted to. He is one person, so he wanted to address even the common man. That is more important. He wanted to make a difference in that common man rather than the more scientists to that level. Anyway, he always used to tell, like particularly during his speech, okay, scientists, the advanced people, they'll reach there somewhere. We want the common man to come up there. So during that time also, I still remember, if you can come to my place, to my chamber, always have that photo of me having a handshake with this thing. So I was just welcoming him at that stage, and at that stage, there were questions with him. So such as if he was just asking me, how is the research going on here? So what exactly you think you can make a difference to this institution? And of course, as anybody's guess, I was totally blank. Okay, just remember standing before him, I was just telling yes, no. You just asked my designation and those things. Rather than getting a welcome, he put on barrage of questions. At that time only I thought like, yeah, this is the person who did so much change for that space program. And not only that, even common person. He was the one who was my common man's president, is it not? So that was, if I'm not wrong, that was the one. So that time I felt, yeah, this is the right person to get that name. And we really, and also while going out also, he was thinking, he just saw many people standing outside. So he made us to put another stand outside. He wanted to address them. So he just wanted the interaction with people. And more importantly, it's not one-sided. He always wanted two-sided. He asked us, any questions for me? So of course we didn't have any questions. So because his presence itself was the greatest thing which we could have. So I just really relished that one. I still remember those days where none of our other colleagues had that opportunity of meeting him and welcoming him, having that photo op which I had, and I still use that photo everywhere, wherever I go. I use that photo. Even in my Twitter account you go, even in my any account you go, I use that. You see, it's one of my coveted things. Photo of my life. Yes.
Right, so truly inspiring, sir.
Yeah.
Sir, also as a person, he's done so much for India, the world space program as well. And sir, what do you think today's students can even imbibe from Dr. Kalam, sir, from his service, his philosophy of service, his philosophy of science? He was a man beyond his great measure.
Exactly.
So what do you think, sir, today's
the thing is, I think he never had that ego that I think he was the person who never had that I. I is the ego, what I felt. So once that I comes, then everything masks. He was the one person who never had that I. So means I know everything. I am the one. He was. I don't think seeing even those 2.5 to 3 hours which he used to stay, he never had that thing. I could see that such a grounded person who has achieved to such a height. So always I think everybody can learn from him that whatever height you go, you always be grounded. I think that's one thing. So that is one thing what I feel is, so the more grounded you are, the more height you can go.
Okay.
There's always a space about it, is it not?
Nice.
Yes.
So, as we take the curtain call for today's episode, sir, I'd like to end with a timeless question. If you would like to leave an piece of advice for the listeners and the minds of tomorrow, what would it be, sir?
Yeah. So mainly, I just want to give some tips to my students, MMCNs, for all this thing. So first and foremost is you are privileged to be here. Okay, you should be, you should always feel privileged, proud to be an MMCN, and more importantly, apart from that one, you care for your parents. Parents are your first choice. Okay, so whatever be the thing, it comes next. And more important, during a stay as an undergraduate, you enjoy as well as. There are two things. Always tell during this thing, curricular and extracurricular. Is it not? Of course, I was there in the extracurricular. It's always extra. It can never become the curriculum. So curriculum, read first. So you gain knowledge from your books, from your teachers, from your patients. They are the greatest teachers of that. I think that should be your first focus. Next becomes the extra. Extracurricular is always an extra one, is it not?
Right.
So I always tell many of my students, we got so many teachers in our campus. So they're all bundle of knowledge. I always tell to the students that at least spend around 15 minutes a day. Don't go asking questions about them. Don't go and ask about a biochemistry person. Go and ask about it. Just go and interact with them. So you learn one or the other. You learn new things from them. If not from the medical perspective, they'll teach you about the life perspective. They'll teach you about the profession, how to be there in this. Because these people have seen 20, 30 years of their profession. So always feel like at least once in a week, spend 30 minutes with one teacher, one professor, one teacher, okay, one faculty. I think that will be the greatest thing which you can. While before leaving this college, you'll treasure those things more than all the those dances, all those extracurricular cultural thing. What you do, of course, cultural will be there. It should be there as a deviation. I told you it should be there, but it's always a deviation. The main road remains the same.
I think so.
Attaining
One of
the
your
knowledge.
biggest advices which you told me, which I still remember, I think in class you had told it. You said the moment extracurriculars become more important than curriculars, you stop being a student. I think
Exactly. I always tell, particularly in Vivas, sometimes I feel, am I taking any moral science class? So sometimes, because some students will force me to do those things, but I always feel like it's not only teaching subject, it's also the duty of every teacher to guide them properly in their life as well. So particularly students, you MMCNs, you're so privileged to be here. Not only you learn about the subject, you got wonderful source of patients and their clinical history, clinical pictures, and not only that, you'll be trained to be a future human being. So for example, if you're staying in a hostel, in our thing, you'll be made, of course, everywhere it is there, but here it's a unique one. You'll be made the prefect. There you'll be learning what to do, what to get, how much vegetables, how much how much dinsi you should be getting, everything, is it not? Yes. So those things you learn. So that will definitely be a treasure for you in your future. Not only that, you'll be organizing these samskrutis, you'll be organizing. So each part you'll be learning. So not only you're doing that, so you're doing all the extra. I think it's a 360-degree development that you can find in our thing. So it's a wonderful thing. So one thing is, first to be a human being first. Be a caring person. I think everything comes next. So I just want to put this end for this one. Yes.
Thank you, sir. Thank you so much, sir, for taking time out of your very undoubtedly busy schedule and agreeing to shoot our podcast with us today. And sir, your valuable experiences and insights has truly been valuable for all the students out there. Thank you so much.
Yeah. One last moment. I just want to leave a message through my song. So sure, one small song. This is from G.S. Shivarudrappa, my favorite poet. So if I'm allowed, yes.
Oh, sure, sir. Yeah.
ಎಲ್ಲೋ ಹುಡುಕಿದೆ ಕಾಣದ ದೇವರ ಕಲ್ಲು ಮಣ್ಣುಗಳ ಗುಡಿಯೊಳಗೆ, ಎಲ್ಲೋ ಹುಡುಕಿದೆ ಕಾಣದ ದೇವರ ಕಲ್ಲು ಮಣ್ಣುಗಳ ಗುಡಿಯೊಳಗೆ, ಇಲ್ಲೇ ಇರುವ ಪ್ರೀತಿ ಸ್ನೇಹಗಳ, ಇಲ್ಲೇ ಇರುವ ಪ್ರೀತಿ ಸ್ನೇಹಗಳ ಗುರುತಿಸದಾದೆವು ನಮ್ಮೊಳಗೆ. You got the meaning?
So you search for
Exactly.
God.
So yeah, so you search for God. Of course, God is eternal. He'll be there everywhere. But you go everywhere in search of Him. Rather than you find that belongingness, that oneness with the people surrounding you.
Love and
So I think that is one thing, compassion,
Right.
which every person should learn. And even my students, I want them to learn this one.
Thank you so much, sir.
Thank you. Thank you very much.